So what we were looking at is developing the breast one-night stay model. For a short period of time, it was also known as the breast 23-hour model that was rolled out nationally. They found that 23-hour was a bit ambiguous and it was very hard to audit when it came to looking at definite admission and discharge times. So we moved it to the one-night stay model. We set up a project group involving not just the lead consultants, but the CNSs, the breast care nurses, nurses from the wards, healthcare assistants, pre-op nurses, and all the way along pharmacy. And we tried to find reasons why they were being admitted the night before and why there was no plan for this patient once they were admitted. We looked at a day of surgery admission policy once we found out it was purely bed blocking. And set up, do all patients need to come in first thing in the morning, or can we try and stagger our admission so that the wards and the admission areas aren't getting 20 odd patients a day, 30 odd patients a day? How was this improvement sustained? What we did was Kelly started it all with this first trust, and at the start we went to all the project groups, and then we gradually left them the reins and left them a bit more. And then I took over from her, and what we then decided to do was, rather than holding hands all the time, was let them walk and run by themselves. So we just did an annual data review. So the quality outcomes, reduction in readmissions, because we weren't getting all the seromas from the drains, then patients weren't getting the infections into the seromas, so there was less readmissions, there was less reoperations. What we looked at, in our area, the tariff has between £200 and £250 bed day for a typical basic B&B. According to the National NHS Improvement, the traditional breast inpatient pathway used to cost £19 million a year. The new model is £8.5 million a year. So across the whole country it saves, and that means it can be spent on new nurses, it can be spent on new equipment. And the main things have been patient experience, patient expectations, and patient safety come first, and the correct utilisation of staff. Standardised information, care plans and analgesia have also been all involved in the future work in other areas. At San Juan West Birmingham Hospital's NHS Trust now provide 94% of all breast surgeries within one day, and they've looked at all the evidence, all the sustainability and all of the outcomes. Thank you.